Hello from Austin, Texas. Bill Culhane with Rick Jennings, making the magic occur. Welcome back, or welcome to the Big Bid Theory microphones, powered by Bid Prime. Matter of fact, Rick and I are getting ready to partake of Bid Prime's 10th anniversary. Quite an accomplishment. Numerous congratulations to everyone at Bid Prime. Anyway, last time out, Dr. Diana Burley from I3P and George Washington University came by to discuss all things cybersecurity and ransomware. Check out the news, right? Ransomware continues to be a problem. Speaking of ongoing challenges, the state of public health in the United States is on the list. Am I right about that? Well, Dr. Rodney Rohde joins us shortly to talk about a number of public health-related topics. In short, with the goal, and you'll hear Dr. Rohde mention it, the goal of improving everyone's health literacy. I could use some improvement. When it comes to vaccinations, are you for, against, or do you consider vaccinations to be something for, those other people to worry about? Stay tuned in a minute. Dr. Rohde is going to educate us. Rick, how's it going, my friend? We talked about it at our production meeting. We have no intention here at the show of gaining a reputation as the show of doom and gloom, but we do want to help inform people about important topics, and longtime listeners know we've talked about terrorism, homelessness, cybersecurity. I mentioned Dr. Burley. Well, in this case, public health.
You're definitely right, Bill. I mean, we certainly don't want to give the impression that we only cover just such negative topics. I mean, we've certainly come a long way and have made so many improvements as a country, and there's just still a few things that we should be focusing on, I'm sure. And in this case, public health is something that we believe everyone should be informed about, and what kind of steps we can take, just to make some improvements going forward.
Rick, everybody's going to hear it in a second. Dr. Rohde is from Texas State and quite the proud Bobcat, as are you.
That is correct. I am also a graduate of Texas State, just like Dr. Rohde, just as of a few years ago. And the really cool thing about that to me is just that we're putting a highlight on somebody, one of our alumni, who is really doing some great things in the field of public health. So without further ado, let's take a listen to what he has to say, and go Bobcats.
Thanks, Rick. Well, here we go. As noted, our guest, a name and voice familiar to our longtime listeners, is Dr. Rodney Rohde. Among his positions, real quickly, he's the program chair for the Clinical Lab Science program at, you guessed it, Texas State University, and a professor in the College of Health Professions. Also important to our upcoming conversation, he is an associate dean for research for the College of Health Professions there in San Marcos. I suspect, and obviously we keep an eye on Dr. Rohde, but I suspect there are very, very few people across the clinical lab spectrum in the U.S. who don't either know the name Rodney Rohde or haven't seen his work at some point along their respective journeys. In this episode, we're not going to talk specifically about rabies. You do want to note Dr. Rohde recently released his book, Rabies, Clinical Considerations and Exposure Evaluations. As a matter of fact, if you look in the podcast description, you'll see a link to that publication. So, with no further ado, here's our visit with our good friend and resident public health guru, Dr. Rohde. Dr. Rodney Rohde joins us on the Big Bid Theory hotline from what many refer to as San Marvelous, a.k.a. San Marcos, Texas. Dr. Rohde, how are things going on down there?
Things are growing well and fast and doing great this summer. Thanks, Bill. It's always a pleasure to be on the show.
Yeah, glad to have you back. And incidentally, an interesting tidbit, at least for myself, D. Rick Jennings, our resident audio engineer and producer, is a product of Texas State University. You Bobcats are everywhere.
Yes, sir. We're all over the globe now, so that's great. That's great to hear.
Rick is a proud Bobcat. So, Dr. Rohde, let's roll up our sleeves and talk about the matters at hand. And incidentally, this conversation most certainly isn't going to be a conversation about the virtues or the negatives about Twitter, Facebook. I hear the cheers from the crowd. But anyway, I do want to ask you this because a number of our listeners know that you are active on social media. We see you sharing opinions, resources, news on events, including the topics we're about to discuss, by the way. But how has social media benefited you in communicating your messages to the masses?
This is a really important question, Bill. I really appreciate it, actually, as a way to kind of open up the conversation. You know, as you probably know, and maybe some of the people that follow me, I really truly believe that science communication and health literacy really might be two of the most critical issues facing kind of global public health and healthcare right now. And social media has really enabled me to share, you know, many important issues, whether it's regarding my profession, the medical laboratory, or my research like infectious disease, like the new book on rabies I just wrote, or antimicrobial resistance, and really just overall public health and healthcare issues, not just in San Marvelous, but, you know, around the world. And so I'm kind of a late comer to social media. I actually got a reminder this morning that I've been on Facebook for 4 whole years. So
Congratulations.
I was a late comer, and as my kids tell me in their 20s, Dad, you know, nobody uses Facebook in my world, but it's still the number one social media platform if you look at the reach around the world. But just in general, social media is such a powerful platform that kind of allows many of us in research and academia and, you know, healthcare and industry and really other areas to what I would say, you know, enables us to tell our story in a way that the public can understand and then share with others. So I think it's really critical that the public understand the value of accurate and truthful information in really all media channels. And we must be out there doing that, including scientists, or others will fill that void with messages and information that are not as accurate or truthful. So as you mentioned when you started, it's good and bad at times, but I really believe it's a powerful platform to globally share messages that can help others.
And I agree as well. And I heard you mention health literacy. That's a topic that you've mentioned before. And that's essentially what we're trying to do in this episode of the Big Bid Theory. And on that note, to prep for our chat, I ran a market analysis this morning in BidPrime's database, specifically on clinical lab, medical lab, vaccinations, and infections, those 4 keywords. And in short, and I mentioned in an email to you, in terms of requests from the public sector, every day we see requests coming from government agencies for those particular keywords. So I would suggest that a number of U.S. agencies are tuned in, and we see infection preventionist, infection control, antibiotic related. What in the world literally is going on? Why are antibiotics, HAIs, which many know are healthcare associated infections, why are those such hot topics right now?
That's another great question. I mean, if you look at the overall emerging and re-emerging diseases that are making such a strong comeback in our country and really around the world, obviously, it's really due to just a variety of complex reasons. For example, things like antimicrobial resistance. It's not just antibiotics, it's antivirals, it's antifungals, it's really any pathogen that's out there has learned to become adaptive and resistant to different types of medications. It's international travel. You know, I literally, at 50 years old plus now, when I get on a plane and go somewhere abroad or even go somewhere across the United States, I still cannot stop myself sometimes from realizing how fortunate we are. I mean, to step off a plane and be in Ireland in 8 to 10 hours blows my mind. It's really kind of interesting. Living longer, you know, gives us more immunocompromised elderly folks. And ironically, even our improved healthcare system in the U.S. and around the world also gives us longer living. And that means sometimes immunocompromised people. And so as you have longer living people, and even due to improved healthcare, having people live into their 80s and 90s and longer, that opens up some interesting opportunities for pathogens to infect those people. We also have, as you know, the anti-vaccination kind of group think that's out there. And so overall, I think, unfortunately, what's happened in the last several decades is we've become a society of what I like to call downstreamist versus upstreamist. And what I mean by that is that we've really become a world of, the question is, which pill can I take, or what surgery can I have, versus how can we prevent those diseases or public health issues. That's kind of more of the upstream thoughts. The old saying, an ounce of prevention is worth a pound of cure, is true all day, every day. And so really for the medical laboratory, all of these topics, and many others, of course, have been really important because our professionals can easily transition into any number of career specialties that you mentioned, like infection preventionist or infection control and public health and regulatory, just academia, which is where I'm at now. So just really all across the healthcare and corporate landscape, our graduates are able to adapt pretty quickly, either with more education or with kind of on-the-job training. So it gives us a pretty big toolkit to get out there and get to work.
That's a great segue to our next topic. That is, and I understand that there are a variety, you and I understand there are a variety of opinions on this next topic, but why, in your opinion, are vaccinations a net positive for this country? And you touched on it earlier, Dr. Rohde. I guess I would dare to suggest our global community. You talked about how people now have it's so much easier to travel. And neither one of my grandfathers ever stepped foot on an airplane, as an example.
It's amazing, isn't it, when you think about it? When I think about my grandmother, who I think went here to Texas State and got her teaching certificate in 1921. I mean, she never left small town Texas. And it just kind of blows your mind to think about the gifts we have at our hands.
Sure do. So vaccinations, those against anti-vaccination, I scribbled down a few of their arguments, and I know you've heard them. Vaccines cause chronic illness, risk, long-term side effects. Vaccines can infect a person with a disease it's trying to prevent, so on and so forth. What have you seen, heard, or studied? Why are you most definitely in the pro-vaccine camp?
Sure. So I'm passionate about this idea.
You are.
And many of my colleagues are. Let me just kind of start off by just kind of giving you a few thoughts on why I think they are so important. And these are really simple statements because I've tried to start communicating in a way that is very simple and hopefully understandable when I talk about these topics. So first of all, immunizations simply save children's lives. It's very important for early childhood protection and into adulthood. Vaccination has been shown to be very safe and effective through just numerous studies of best evidence. It also protects others you care about. So one of the things that people should realize is that protecting yourself and your children with vaccines may protect others that can't get vaccines because they are immunocompromised or they have other health issues that doesn't allow them to be immunized. So you're doing a kind of a public health benefit for all those around you. It can save you time and money, obviously from healthcare, and it really helps protect future generations. And this is not my opinion. This is the data that's out there. Vaccines are the most safe, most evidence-based and researched, and the most effective and economical public health measure to prevent infectious diseases, period. I mean, they work, they save lives. But having said all that, it's really incumbent for those of us in healthcare and public health, like myself, to really effectively communicate this accurate information to what I would really call a new public. And again, Bill, I think you'll understand what I'm saying here. Many of what I call this new public are really people that have grown up with the benefit of perhaps never having had to deal with their children dying from things like polio or smallpox or any other deadly diseases that affect us. In fact, ironically, our success in public health and in vaccination is really one of our biggest issues with this newer generation that have directly benefited from vaccines. So it's like, I often explain this to people in the public, it's like other public health successes, like clean water. We all take it for granted until it's not there or it's not working. For example, when you travel to another country or somewhere like Michigan, in Flint, Michigan, that that had that issue with lead. It's not quite the same, but it's still a public health issue. So it gives you some things to think about. And if I can take just one quick moment to share a little bit out on vaccines and infectious disease perspective, this is really current, and so I want your audience to kind of think about this. So Ebola, that we're all deathly afraid of, has a very high fatality rate. It reaches 80-90%, but it's really difficult to spread in actuality, whereas measles kills fewer as a percent of those infected, but it is one of the most transmissible viruses known. In fact, it's right up there at the very top with respect to, it's called an R naught. It's how many other people can a virus infect, and measles is one of the top. And in reality, measles has now killed more than Ebola in the current Democratic Republic and Congo outbreaks of both viruses. So in really in just 4 months now, in 2019, CDC has reported 465 cases of measles in 19 states in the U.S., really from a virus that was completely eradicated in the year 2000. So this kind of blows the minds of those in public health, because mortality rates for measles can be as high as 20%. It's just problematic when we have non-vaccinated populations and that kind of group think again going around something that they think, well, it's okay to get it naturally and become immunized. And in a sense, they're correct. I mean, if you get the actual measles virus and live through it, you are probably going to be protected. But it's also kind of like, any other thing where you say, why would you not protect yourself from something that 1 in 5 chance might kill you? So it's just kind of a vicious circle sometimes when you think about the safety factor.
Maybe your health or the health of your family members or those around you isn't an appropriate time to roll the dice.
Exactly.
As it were.
And that's, we could talk about this all day, so and I don't
Sure.
want to get onto that. But I mean, even thinking about, so like my wife is a preschool teacher, and, it really gets into kind of public health rights. Like, is it safe to allow the public not to be vaccinated, but they can still bring their children into a daycare or to a school where parents are expecting that to be a safe environment? It's really something to think about when it's not just you, it's others involved.
Yeah, that's very well said. And I think it's interesting to know that this is the big bit theory. But this morning when I got into the studio, I inquired, and at least governments are taking note. Just last month, the month of June, saw the highest number of vaccine-related requests from U.S. state, local, and federal agencies. That's looking over the past year. So it appears as though the public sector is on board somewhat in that respect. And maybe that's an attempt at another segue. But Dr. Rohde, understanding that many industries, many interests can always use more financial resources, you are out and about. You communicate with those at or near the very top of the medical laboratory world. What is most needed from the public sector, from state, local, Fed governments, so that you folks can not just do your jobs, but do them well?
Well, that is a large platform. I appreciate the
Give me
opportunity
30 minutes.
to step onto it. Certainly funding. I mean, everybody needs more
Sure.
money to conduct smarter, and so really to conduct what I would call smarter and more applicable research. And I think, just to kind of to mention Texas State here, because it's also where I work. One of the interesting things about what we're doing here is that we are trying to work smarter and more applicable research. So I think that's really important. The funding is definitely necessary, but we need to be good stewards and find better and smarter ways to use it. But let's focus on one really important topic that I think is in the world of the medical lab, but also all of healthcare. So this might be something that we've talked about before, but it's kind of a new twist on what's happening in our world. So in my circles, as you mentioned, I'm out there kind of roaming across the country and doing talks and meeting with different folks. And really what we're trying to work on right now that I think is very important for everyone, including across healthcare, is to try to break across what I call, and many call sometimes silos, with respect to physicians in the medical lab. So we're trying, and we really are successful right now because we've started this. We're trying to create what's called a diagnostic management team. And this is being led by our new doctorates of clinical laboratory science. It is called a DCLS. So they're medical laboratory professionals that have several years of bench experience, sometimes over 5 years. And they've basically gone back to school to obtain a DCLS, which is really a professional doctorate that we believe will help bridge the gap between the medical lab and the physicians and other healthcare professionals. We now know, in fact, I just sat through a talk with a colleague who's done the research on this, who is a DCLS. We now know that in medical school, they barely scratch the surface in their curriculum and training anymore for medical laboratory testing and interpretation. So from like the 50s and 60s, they were doing much higher percentages in this area. But because the field of healthcare has expanded, as you know, and it's become so complex, that's where the cuts kind of happen in the curriculum. So it's in some areas it's lower than 5 to 7%. And yet we rely on our physicians to kind of understand everything. So this is a gap because the medical lab has become a very complex and difficult landscape to navigate without expertise. And if you look at medical errors in the U.S. and around the world that can become deadly, they occur because of that gap. So these diagnostic management teams that are being led by DCLSs are now available. So this is really exciting. There are 3 DCLS programs in the country. There's one at Rutgers. There's one down the road at UTMB Galveston, and the most recent, the University of Kansas Medical Center. And we have our first DCLS out there. Her name's Dr. Brandy Gonzola. She's in Georgia. And I actually consider her a medical lab pioneer because of what she's doing. She is actively working and rounding with physicians out on the patient floor. So this is new for the medical lab professional. They are out there rounding with the doctors. And for instance, when they have a question about a particular drug that may have contraindications to use for different types of events, or if they can't interpret a really complex molecular diagnostic test because it was never in their curriculum, just any number of things, Bill. I mean, it's really exciting, and it's actually really frightening that we haven't had this before. So they're doing these things now. We've even had multiple others that have been graduating this May from different programs. So those are going to continue to grow as programs get up and going. We've even had one of our former Texas State CLS program alumna. Her name's, well, now it's Dr. Tiffany Flowers. She just recently graduated from UTMB Galveston. And so with some of the other podcasts, like with Outbreak News, or some of the articles I write, like with Elsevier Connect, I've been out there talking about preventing diagnostic errors with these diagnostic management teams and the DCLS. So when you think about local, state, and federal, and even what I'd say international governments, they really need these professionals, and they need them yesterday. And so I really appreciate, again, this platform to kind of help get that word out, because it's so critical that we have these types of things going on. And of course, like many others, you know, in healthcare, if I kind of step back from my own medical lab kind of focus, we're worried about, you know, the gap and shortages in all professions in healthcare. There's so many people retiring. It gets a little frightening when you look at the numbers of what's about to happen. Of course, it's happening in all areas of employment, but certainly in healthcare, we're really worried about that. Healthcare and how we're going to afford it with respect to insurance. I mean, there's so many topics, but if you're out there and you're interested in becoming, you know, a medical lab diagnostic detective, then give our majors and our professions a look, and we'd be happy to help you try to find that.
Hashtag we save lives every day, right?
That's right. I mean, and you know, I think I've mentioned this, it's 100% employment, Bill. I mean, when you get through our program, and any program across the country, so not just stumping for Texas State CLS, although we have an outstanding program, there are many across Texas and across the country. So wherever you are and wherever you're listening, these are critical positions, and they offer wonderful careers, diverse career paths, and literally 100% employment when you walk out the door with your diploma. Our 18 seniors that graduate August 9th, 2/3 of them have jobs pretty much lined up already, and that's every summer. So it's a wonderful thing, and parents really love that as well. So,
yeah, no doubt. Well, outstanding work, obviously, Dr. Rohde, that you and the folks there at Texas State and elsewhere are doing. I think it's somewhat interesting. Those who listened to our show from last time, we had Dr. Diana Burley on, and we talked about cybersecurity, and we talked about the building of the cybersecurity workforce of the future. And I know that you folks down there at Texas State are doing great work. And as you pointed out, I pointed out elsewhere as well. Well, Dr. Rohde, on behalf of our audience, thanks so much for visiting with us. Before we let you exit stage left, I know you have other obligations today. Are there any resources you'd like to point people towards in support of the topics we've covered in our conversation?
Sure. I mean, I always recommend the Centers for Disease Control around any of the topics that we've talked about, the World Health Organization, just for the audience to really look for accurate and well-respected sites. Then with respect to my own work, I have a Texas State personal website as well as a Clinical Lab Science website that can take you to any number of podcast and videocast and other articles and research that I've conducted, including ones like we're doing right now.
As I know, Dr. Rohde, you're aware, and longtime listeners know that Rick and Kevin will include those references in the description of the podcast. And Dr. Rohde's Twitter handle, if I may, Dr. Rohde, it's at Rodney Rohde, RODNEY ROHDE. Well, Dr. Rohde, all the best. Again, your team down there at Texas State University in San Marcos, and hope to talk with you again soon.
Thank you, sir. Y'all have a great day, and I appreciate the opportunity as always.
Again, appreciate that so much, Dr. Rohde. Go to the description of the podcast for that Twitter handle and also those other references we mentioned during the conversation. Now it's time for Crazy Bids. In Crazy Bids, we're actually going to stay on topic. As I researched in prep for my chat with Dr. Rohde, in particular, one bid in BidPrime's database grabbed Kevin's attention as he was looking through trying to put together some information for me. The U.S. Defense Logistics Agency has a bid for smallpox vaccine. Smallpox vaccine? Dr. Rohde just mentioned the reemergence of measles. Well, back in 1980, the World Health Assembly declared the global eradication of smallpox. This is 2019. So while no cases of naturally occurring smallpox have happened since, clearly there are organizations continuing work on vaccine development, there's that word again, drugs and diagnostic tests to protect people against smallpox if it does indeed reemerge somehow, some way. Go to BidPrime's database if you want more details on the crazy bid. Well, that's going to do it. Another episode of the show in the books. Again, Rick and I are getting ready to head over to BidPrime's 10th anniversary celebration. We so much appreciate you sharing, downloading, and following the Big Bid Theory. You can send us an email. Sending it to me is probably your best bet. And if there's a topic you want to hear about, let us know. You can shoot me an email at bculhane@bidprime.com. You can follow us on Twitter. Right after you get done following Dr. Rohde on Twitter, follow us at The Big Bid Theory. My personalized Twitter is contract_hunter. And, of course, we're also on Facebook as well. Powered by BidPrime. For Kevin Henderson and Rick Jennings, the proud Bobcat. By the way, Kevin and Rick always make sure their vaccinations are up to date for their benefit and those around them. Speaking of Texas State Bobcats, thanks to Dr. Rohde, this is Bill Culhane. Until next time, go Gunners, Barracudas, Tigers, Bobcats, and Cubs. And we wish you all the best in growing your business.
Powered by BidPrime, we thank you for tuning in to the Big Bid Theory. From Austin, Texas, the show is produced by Bill Culhane and Jim Ward. Producer and engineer is Rick Jennings. Distribution, research, and production assistance by Lauren Jones and Kevin Henderson. You can find other episodes of the Big Bid Theory on platforms to include iHeart, iTunes, Spreaker, and Google Play.